6:23 now. Doctors and medical students are warning we're at a critical crossroads, with 86% of those questioned by the British Medical Association saying they believe a second coronavirus peak is likely in the next 6 months. It comes as limits on social gatherings come into force in England, Wales and Scotland from today. We're joined now from Bath by Dr. Bharat Pankhania, an expert in infectious disease control from the University of Exeter. Good morning to you. Thanks very much for joining us this morning. So what do you make of the findings of this British Medical Association survey, that they're saying 86% of medics that we are likely to have a second wave or highly likely, and it's their number one concern? What's your feeling about when this is coming and how severe it will be?
I feel that they are not off the mark because we've got a high level of background cases. Furthermore, the case numbers have been going up, and then we've got the reopening of the schools and this drive to also get people back to work, back to their offices. And when you put all those items together, it is inevitable that case numbers will go up, as they have been over the last few days.
And from today, we are seeing this new rule of 6. We're also seeing more local lockdowns being put into place. Are you confident that the restrictions that we're seeing are going to be enough to keep this under control, or what more would you like to see?
No, whilst I welcome the restriction of numbers that you mingle with, I think the clear health message should be, please reduce your interactions with other human beings, because 4, 8, 10, what is the right parameter? The only right parameter is to consider everyone and everything as potentially infected and infectious, and therefore you take care amongst people that you don't know, because the one person that you mingle with may be mingling with hundreds of others, and therefore you could get infected. A better health message is, don't get infected, don't infect others, and reduce your mingling with other human beings.
So do you think the government is giving an urgent enough message to people? I'm looking at the front page of the Times, where they're saying act fast or lose control within days. That's according to Peter Openshaw, who's a coronavirus expert. I mean, are the government putting that message across that actually people need to be taking much more strict control of their contacts? Otherwise, it's going to get out of control.
You're absolutely right, and my colleague is absolutely right. And you know, the thing is, we talk a lot about test and trace, but we need to be clear. Once you have got a huge surge in numbers of cases, test and trace cannot work. Therefore, the only thing we can do is act hard, act fast, act immediately. Because when you've got case numbers that are just about manageable, you need to give those additional warnings, which is, keep away, keep your guard up, don't drop your guard, be careful amongst other humans, reduce your interactions going to pubs, restaurants and other places. So those messages, in addition to now it is the law that you mustn't mix with more than 6, is what is required. Those health messages need to come hard and fast and early.
And are you confident about the test and trace system? I mean, there are concerns about how effective it is already. We've heard that there's a backlog of some 185,000 swabs that are having to be sent abroad to be processed. If things are about to get worse, do you think the system can cope?
No, it's a tragedy. It really is. I feel very sad because the United Kingdom is a first world country. How and why we have mismanaged the test and trace by centralizing it, bypassing the National Health Service, university and other laboratories and setting up new labs, when we could have been collaboratively and asked the NHS labs, the university labs and all the other people to join in and do the testing, baffles me beyond belief. And as you can see now, they've reached capacity, and finally at the last minute they're allowing other people to also set up testing. But we should really be working with local labs as well as having the new labs working together so that we have extra capacity.
OK, Dr. Bharat Pankhania, thanks very much for joining us this morning.